Did you know that 1 in 3 women worldwide will suffer a fracture due to osteoporosis in their lifetime? And here is the terrifying part. If you break your hip after age 70, your chance of dying within 12 months is 25%. Half of the survivors will never walk independently again. But this is the truly insane part. Almost everything you have ever been told about preventing osteoporosis, drink milk, take calcium, take vitamin D, has been debunked by science. Today, I am going to share the truth from one of the world's leading osteoporosis experts, Professor Cyrus Cooper, president of the International Osteoporosis Foundation, who was just ranked among the top 50 scientists on the planet. Before we begin, Lean Life does not provide medical advice. This video is for educational purposes only and is not a substitute for diagnosis or treatment from a healthcare professional. So, what is osteoporosis exactly? Imagine inside your bones there is a honeycomb structure, layers of collagen stacked together, and nestled within the gaps of that collagen are calcium crystals. In someone with osteoporosis, both the collagen and the calcium are depleted. The honeycomb becomes sparse, porous, and weak. And here is the terrifying thing. You feel nothing. Osteoporosis is called the silent epidemic. You can fracture a vertebra just by rolling over in bed. You can break your spine lifting a suitcase in a hotel lobby. The majority of vertebral fractures caused by osteoporosis are discovered by accident, on an X-ray taken for a completely unrelated reason. The patient had no idea they had broken a bone. This is why you have seen elderly women with a hunched back. It is not old age. It is vertebrae silently fracturing and collapsing, one by one, over years. Now I am going to reveal something that will completely change how you think about your body. The skeleton you walked into this room with today is not the skeleton you will walk out with. Every 10 to 12 years, your entire skeleton is completely replaced. Not part of it, all of it. How does this happen? Across your skeleton, there are millions of tiny work crews. One crew digs out old bone. Those are called osteoclasts. Another crew fills the hole with fresh new bone. Those are called osteoblasts. Think of them like road workers. One crew tears up the old asphalt. Another crew repaves it. When you are young, these two crews work in perfect balance. But as you age, and especially when women go through menopause, everything changes. This is the single most important thing you need to understand today. When a woman enters menopause, estrogen levels plummet, and estrogen is the manager of the bone-building crew. When estrogen drops, the demolition crew keeps digging, sometimes even faster than before. But the construction crew slows down dramatically. The result? Every year after menopause, you lose more bone than you build. This is why 1 in 3 women will suffer an osteoporotic fracture, but only about 1 in 10 men. Men do get it, but at a much later age, usually after 70. And here is the cruel irony. Osteoporosis in men is frequently missed because neither doctors nor patients think men can get it. Pause for a moment. I have a question for you. What do you think is the best way to prevent osteoporosis? Drink a glass of milk every day? Take a calcium pill? Take vitamin D? If your answer was any of those, you have been lied to. Let us start with calcium. For decades, we have been taught bones contain calcium, so you must eat more calcium to have strong bones. It sounds logical, but the body does not work that way. Large-scale clinical trials have shown calcium supplementation does not reduce fracture risk. Worse, Some observational studies suggest that calcium supplements may actually increase the risk of cardiovascular disease. Professor Cooper said it plainly: "I would not take a calcium supplement." So where should your calcium come from? Dark leafy greens, legumes, mineral water, all contain calcium. Our bodies evolved to absorb calcium from food, not from a massive pill that hits the gut like an atomic bomb. Even vegans, if they have a diverse plant-based diet, are not calcium deficient. Most of the world does not consume cow's milk, and they do not have higher fracture rates. But what about vitamin D? This is the most shocking part. Professor Cyrus Cooper conducted a 3-year trial on older adults. He split them into 2 groups. One took vitamin D, the other did not. The result? The vitamin D group had more fractures. Not fewer, more. A study in Australia found the same thing. When you pool all the trials together, the evidence shows vitamin D supplementation for the vast majority of the population provides no bone benefit whatsoever. It may even cause harm. And yet, the governments of the UK, the US, and many other countries still recommend that people take vitamin D daily. The supplement industry makes billions of dollars from this false belief. There is one single exception: pregnant women. Cooper's research found that low-dose vitamin D supplementation during pregnancy can help babies be born with better bone density over the long term. But that is an entirely different story. So what actually helps keep bones strong? Here is the good news. Diet can reduce your fracture risk by 30 to 40%, but not through calcium or any single micronutrient. It is the overall quality of your diet. Plenty of fruits and vegetables, diverse plant intake, limiting ultra-processed foods, junk food, and sugary sodas. This is a crucial mindset shift. Calcium is in your bones, but putting calcium into your stomach does not mean it will land in your bones. It is like having a pile of asphalt sitting in front of your house. That does not mean the road is going to get repaved. You need the work crew to come and do the job. And the bone work crew operates based on signals from your entire dietary pattern, not from a single pill. And now we come to the part that almost everyone overlooks: movement. Did you know that a tennis player's racket arm has 15 to 20% higher bone density than their non-racket arm? Bone responds to impact, not muscle strength, impact force, the load pushing down through the skeleton. This is a critical distinction. Swimming is fantastic for your muscles and your cardiovascular system, but it does almost nothing for your bones. Why? Because in water, there is no impact loading on your skeleton. A gentle hour-long walk may be less effective than 2 minutes of jump rope. The reason? Bone-building cells are sensitive to sudden changes in force, not to steady, sustained pressure. This matters at every stage of life. Toddlers, the moment they start walking, their bone density skyrockets. Astronauts in space, their bones dissolve because there is no gravity. Someone paralyzed in one limb, the bone in that limb loses minerals at an alarming rate. The message is unmistakable. Bone needs impact to survive. And you do not need to run a marathon. Brisk walking for 30 minutes a day, 5 days a week, that makes a difference. 2 minutes of jump rope per day. Heel drops, standing up and dropping down onto your heels. Taking the stairs, dancing, carrying groceries. Professor Cooper had a memorable line: "Let your grandmother carry her own suitcase." Pause again. If you are thinking, "I am 50 years old, I have already gone through menopause, is it too late for me?" The answer is no. There are genuinely effective treatments available. The first-line class of drugs is bisphosphonates. 1 pill per week can reduce fracture risk by 50%. There is an intravenous version given once a year. There is a subcutaneous injection every 6 months. Hormone replacement therapy provides nearly equivalent bone protection. And the newest generation of drugs, bone-building agents, are even more powerful, capable of rapidly restoring bone density. But there is an important caveat. Timing matters enormously. Start treatment too early, and the drug may lose effectiveness by the time you truly need it in your 70s or 80s. Professor Cooper shared that he has had to tell many patients in their 40s and 50s, you do not have osteoporosis. Your bones are completely normal for your age. Come back in 15 years. Meanwhile, countless people in their 70s and 80s who genuinely have osteoporosis are never diagnosed at all. So, from everything we have covered, here are 5 specific actions you can take starting today. Number 1, assess your risk. Age is the most important factor. If you are over 65, ask your doctor about a DEXA bone density scan. Do not panic if you are 45 and told you have low bone density. It may be perfectly normal for your age. Number 2, stop wasting money on calcium and vitamin D supplements. Unless prescribed by your doctor for a specific condition, the scientific evidence does not support mass supplementation. Spend that money on fresh fruits and vegetables instead. Number 3, improve your overall diet quality. More leafy greens, diverse plants, fewer ultra-processed foods. This alone can reduce your fracture risk by up to 30%. Number 4, do weight-bearing and impact exercise. Brisk walking, jump rope, stairs, dancing. If you only swim, add at least one impact activity. Just 2 minutes of jumping rope per day can make a difference. Number 5, never assume osteoporosis is an inevitable part of aging. This is the biggest myth that Professor Cooper wants to erase. Osteoporosis is preventable. Fractures are preventable. And even if you have already been diagnosed, there are treatments that genuinely work. Remember this. Your skeleton is not a dead, fixed structure like your teeth. It is living tissue, constantly renewing itself. Every 12 years, you get an entirely new skeleton, and you have the power to decide whether your next skeleton will be strong or fragile through what you eat, how you move, and the choices you make starting today. The question I want to leave you with, are you moving in a way that builds your bones? Are you wasting money on calcium and vitamin D pills that science has shown do not work? Share your thoughts in the comments. If you found this video helpful, please like and subscribe to Lean Life so you do not miss the latest evidence-based health knowledge. Once again, Lean Life does not provide medical advice. Please consult your doctor before making any major changes to your diet or exercise routine, especially if you have an underlying health condition or are taking medication. Thank you for watching. See you in the next video.